We'll now hear the talk by Professor Giovanni Di Minno with regards to the convalescent plasma and its use in the COVID-19 patient. Dr. Giovanni Di Minno is a professor of clinical medicine, a chairman of the Department of Clinical Medicine and Surgery, and the director of the Hemophilia and Thrombosis Center at Federico II University Hospital at Naples, Italy. Professor Di Minno was the president of the Italian Association of Hemophilia Center. Without further ado, we'll hear the presentation for the talk.
Mr. Chairman, ladies and gentlemen, thank you for your kind invitation and for asking me to present this important area of experimental and clinical medicine. And I am just presenting a recent editorial that I have prepared together with a series of colleagues that are reported here in this slide concerning what we have learned and how relevant is the use of convalescent plasma for passive antibody administration against viral agents as far as the pathogen safety issue of plasma is concerned. And after having shown you my disclosures, I just want to start with a recent table of early studies with convalescent plasma in moderately to severely ill patients with SARS-CoV-2. And based on the results that have been achieved in these studies, and that
you are
have been
currently the only person in this conference.
Studies that have coming up in the literature over the last, say, 1 year, we have learned that in reality this strategy might be useful in general to confer immediate immunity to susceptible individuals in conditions where it is not possible or there is not enough time to generate immunoglobulin preparation. However, based on the data that I showed you before and that are very well known in the literature, in reality, there is a series of reasons, a series of confounders, issues related to sensitivity, specificity of tests, and sample size and dosing of treatment that make it difficult to generalize the results and argue for large-scale controlled trials. This is something that is going on now, and there is a series of reports that appear, let's say, every week in the literature concerning the specific issue. Now, in addition to their obvious pathophysiological and therapeutic relevance, the data concerning the use of convalescent plasma used in these patients are very important concerning the issue of plasma and pathogen safety of plasma and plasma-derived products. It is important, first of all, to stress the concept that plasma and plasma-derived products are in the list of essential medicines of the WHO, since they include coagulation factors, albumin, and immunoglobulins. Now, the use of these products, including plasma, is the result of an industrial preparation of pharmaceutical products from plasma, from human plasma. And it is important to stress these concepts because the way we prepare them now is the result of a long discussion and a long series of data that have been collected over the last, say, 30 to 40 years. In conditions such as bleeding disorders, including hemophilia, von Willebrand disease, and so on and so forth, management of bleeding disorders is based on the use of plasma and plasma-derived products. In reality, we also have recombinant factor concentrates. However, they are available only for some products. For instance, we have recombinant products for hemophilia A and B. We have recombinant recombinant products for factor VIII. Now we have some recombinant products for convalescent, but in general, for the vast majority of products, there is not there is no availability of recombinant products. So plasma and plasma-derived products are still key for the treatment of these patients, and the same is true for the use of albumin and immunoglobulins. Now, in hemophilia and rare bleeding disorders, we have learned starting in the 80s when we started using largely plasma-derived products that at least 2/3 of our patients became infected with HIV or HCV, not with HPV, just because vaccination was very important under those conditions to avoid infections. Now, this infection was not irrelevant. There was a series of deaths in our patients, and this happened all over the world. Here you see the data concerning UK, USA, Italy, and the Netherlands, and you see that in reality the issue was very relevant, and it was the reason why a series of considerations were made in order to prepare, to organize new ways to prepare plasma. And in reality, EMA and FDA established a series of guidelines at that time to prepare plasma and plasma-derived products for human use, and such guidelines were very important in view of the fact that no pathogen transmission for HCV and HIV was reported from 1987. However, this is important this is relevant concerning these two pathogens. The problem is related to the vast majority of other pathogens. Now, guidelines were very useful even those days for preparing convalescent plasma for SARS-CoV-2. All the guidelines were followed to prepare this convalescent plasma, and no major problem once again occurred concerning pathogen safety of plasma-derived products. Nevertheless, new viruses are continuously emerging, and the problem is that the way we prepare plasma now gives us the opportunity to be sure about major pathogens that we have known in our past. We don't know enough about what will happen in the future. That's the reason why now we talk about the so-called emerging pathogens. This is a general definition, a wide definition that includes causative agents of an infectious disease, including new infections, re-emerging infections, or infections with new characteristics. And when we talk about emerging pathogens, we talk about pathogens whose incidence has increased or may increase based on their appearance in new host populations or changes in an existing population. And this is something I want to stress right away in our discussion. We have learned that now there is a series of conditions for the emergence of new infections and new pathogens. For instance, changes in climate are very important from this point of view. Ease of travel that includes, that facilitates the traffic of microbes and infections. And finally, the concept that viruses have very good characteristics to become emerging pathogens in view of the fact that they become very easily adapted to the new condition they meet. It is also relevant from our point of view to stress once again the concept that major emerging viruses and prions that are reported in this slide, for instance, are transmitted by blood and plasma products, just because of the fact that they are usually accumulated in blood and, of course, in plasma. And first of all, I want just to call your attention on a series of new emerging pathogens. And in addition to their detection methods, I also wanted to report inactivation or elimination methods. And you see that there are very important differences as far as enveloped viruses are concerned, whose inactivation is rather easy and whose detection is rather common, as compared to non-enveloped viruses, whose inactivation is just a little bit more difficult, and prions, which are resistant to conventional forms of inactivations, and for which we have no screening tests whatsoever. So, of course, this indicates a series of other conditions that should be considered thoroughly when we analyze them. Now, let's move to the next concept. How emerging pathogens may become an outbreak of new infections and epidemics or pandemics. The concept of zoonotic transmission is very important as far as pathogens we are dealing with today. In reality, there is a series of conditions, including bites, including foods, and so on and so forth, that are very important to spread these factors, these pathogens in the general population. And it is very important to take into account the possibility that this transmission between animals and humans is becoming very important from a practical point of view. How do we protect from outbreaks of infections? It is important to spend few minutes in introducing these concepts. We have to say that outbreaks, the spreading of an infection, is the result of a complex interaction between three components: hosts, pathogens, and environment. Of course, pathogens have to be strong enough. Have to be quantitatively important to cause an infection. Hosts, of course, the immune system of hosts is very important from this point of view, because in general, the immune system of hosts is very resistant and is an important barrier to avoid infection. And environment usually was in defense of hosts. Now it is becoming in defense of pathogens. And I showed you some information. I alluded to before, some information concerning the specific issue. Which is the line of defense that we have against emerging pathogens? First of all, the immune system, I told you. In reality, however, you realize very easily that when you become older, when you have diabetes mellitus, when you have rheumatoid arthritis, when you have kidney failure and so on, your immune system is compromised, and your possibility to get an infection increases dramatically. This is the reason why we have to think about elderly people to protect elderly people against emerging pathogens. There are some data concerning genetic factors that increase protection, immunological protection. In reality, there is a series of genetic factors which are strongly related to immune deficiency and may somehow control the risk of acquiring infection. And finally, there is the issue concerning environmental factors I alluded to before. The second line of defense is related to health vigilance. There is a series of systems all over the world that are very important from this point of view. We have WHO, which is very important from this point of view. Ebola was somehow controlled in its spreading just because there was an every week information concerning the specific issue. And this is true not only for Ebola, very recently for Zika, we had very similar system of information spreading, which was very important. And there is a series of other sources in addition to WHO, FDA, EMA, JPAC in the UK, that are very important from this point of view and that are very supportive to protect spreading of germs. And finally, there is the preparation of plasma-derived product, the medicinal preparation of plasma-derived products. And here there is a series of conditions that should be that industrial companies should meet while preparing hemoderivatives, that include the plasma collection at very sophisticated centers with very sophisticated technologies at specialized centers, continuous inspection of the strategies employed, screening of each donation, and rescreening with mini pools for 5 different viruses, and preparation of plasma master trials approved every year by system controls, and the use of solvent detergents, superheating, and pasteurization or nanofiltration. This is very important, and I told you this was very important to avoid HCV and HIV so far. Nevertheless, we have to consider that risks are somehow still present as far as plasma and plasma-derived products is concerned. In low-income countries, the type of strategy I alluded to in the previous slide, the so-called virological approach, that the different steps of the virological approach implies to discard almost 1/3 of collected plasma. In some cases, this might be an unnecessary wastage of blood. And this is not really followed up in different countries. In reality, I am saying that economic pressures may encourage the use of hemoderivatives from countries where the so-called virological approach is not entirely followed up. And this might cause threats to safety of such products. And just to try to summarize the issue, what we are trying to say and what we have alluded to in our editorial is that lessons from hemophilia treatment and more in general inherited bleeding disorders is very important from this point of view, because it might help improve safety of a critical resource like plasma and plasma-derived products. And this is not only true for the treatment against emerging and pathogenic infections in reality, from a worldwide perspective, if we don't have enough convalescent anti-severe anti-SARS-CoV-2 plasma from high-income countries, the use of plasma from other sources should be considered, that might cause additional changes. And in addition to other problems which are related to the type of plasma and convalescent plasma we use, which means the content of IgG instead of IgG and IgM, and the type of preparation, the type of preparation concerning the percent of anti-SARS-CoV protein, and so on. In addition to these issues, we have to think about the pathogen safety issue concerning this plasma. Our opinion is that this is the right time to improve blood banking all over the world, and that this might be key to improve plasma and plasma-derived products preparation all over the world, and have a central resource for the future of our patients. In addition to this, it is important to know perfectly the pathways, the way we prepare plasma and plasma-derived products, or convalescent plasma products from this point of view, in view of the fact that we have to inform patients. It means that doctors and healthcare professionals have to gather a good understanding of the modes of preparation, source and modes of preparation of products that are used to treat those patients. And of course, this is very important because once they have enough information on the specific issue, they will be prone to give a complete information to patients in achieving, in collecting, in gathering the informed consent form. Of course, one of the issues that should be clarified is the extent to which persons that will sign informed consent should be informed on specific risks associated with specific products. And this is something that in reality belongs to different cultures and belongs to a more wide discussion that we don't have the possibility to make right now. Thank you for your attention and best regards from my town.